What does a type 2 diabetes reversal system look like? In other words, what are the components of a system geared towards reversing insulin resistance and hence thereby type 2 diabetes look like? Welcome to this video. I'm your host, Dr. Soham Patel. For people who don't know me or they're watching this for the first time, I'm a board certified endocrinologist and lifestyle medicine physician. And so in this video, we're going to go deeper into understanding what are the components of a type 2 diabetes reversal system. Now, I think the first and foremost that people would answer, what would be the components? The first thing that comes to mind is diet, right? Rightly so, but I have a different perspective, and that is looking at it as a nutrition chain that is for your lifestyle, for sustained rest of your life. Because if you look at it as diet, you are setting yourself up for failure, because you're going to only you tell your brain it's temporary when you say diet, and you only do it for a little while and then you don't do it. That yo-yo pattern actually leads to more harm than benefit. So looking at it as a lifestyle change geared towards nutrition and focusing on eating the right foods at the right time in the right combination. That's the key focus of how you would want to look at nutrition as a key component of type 2 diabetes reversal system. But nutrition is only one aspect. From more than a decade of my experience and learning from interacting with my patients and clients is that it has four components to this system for you to get sustained and lifelong reversal of type 2 diabetes. And so the key component after nutrition is activity. Now, understand I said activity, not exercise. And you can exercise by all means. You want to spend an hour in the gym and you enjoy doing that, do it by all means. There is no harm in that. But most people may not be up for spending an hour in the gym every day or 4 or 5 times a week. But being active can actually get you a lot of benefits without having to spend that hour in the gym. And so when you incorporate that activity in your day, actually gets you more benefits. So activity is more important than just exercise. And like I said, if you like to work out in the gym, do it by all means. There is no downside to that if you really enjoy doing that. But if you're focused on creating a system and you have so many moving parts, then activity always trumps exercise in terms of the benefit. The third aspect of the system is your beauty sleep. Okay? We encounter different physiological insults throughout the day with our modern lifestyle. And sleep is where we actually work on regaining that balance and detoxification and all kinds of things that happen in our sleep. And so if you don't get good sleep, you can actually single-handedly undo the benefits of the right nutrition and activity. And that creates more frustration because you're trying to do all these things to, get your health in shape and you're not seeing the results, which takes you away from the goal of reversing type 2 diabetes, and we don't want that. Our single pointed focus is to work towards the goal of type 2 diabetes reversal. Okay, so that's the third aspect. And last not the least is stress management. Now, stress is not a bad word per se. Stress is important in life, because if you don't have any stress in life, then you won't have the life for reason to feel alive, because stress is a challenge, and that that leads us to expand our horizons. So the right type of stress where we are actually being challenged and feeling alive is important and necessary. The problem happens when you feel chronically stressed and you feel like a big burden that keeps bogging you down in different aspects of your life, that's where bad things happen. Okay, now 9 out of 10 times, our perception and our expectation of the situation creates the stress more than the situation itself. Now, there may be situations, like I said, 1 out of that 10, where it's truly stressful any way you look at it. But most of the times, it's our perception and expectation of the situation which creates the stress than the situation itself. And so if we can work on modifying the viewpoint and the approach on how you look at things, in which there are many different ways to do that, you can create a system that can keep your chronic stressors down and be able to, use the stress in the right manner, which is, being alive, feeling alive, and expanding your horizons and frontiers throughout your life. But this is important because if you do not handle stress, the chronic stress appropriately, like sleep, again, it can single-handedly undo the benefits of right nutrition and activity. So all 4 components of this, that I talked about: nutrition, activity, sleep, and stress, all 4 of them are very important. And, they're equally important, not that you do too much in one aspect and ignore the others. I can probably sense that whoever is watching this is probably feeling stressed now, right? Don't be stressed. I'm going to create separate videos on each of these 4 components to explain further, why they're important and, what role they're playing in this metrics of how to reverse type 2 diabetes. So keep your stressors down, look forward to life, keep striving for health. Till the next video, and we'll talk about nutrition in the next video. Okay? So keep striving.